Alright, so when we look at the lower extremity muscles, the way what we're doing is, or the way I do it, is I go by function. I go by what does what in the body. As we start, I like to functionally go into the muscles of the posterior back, the butt area. These models are pretty good with showing this. We can see the big butt muscles right here, and if we take the layer off on top, the first one we get to the one that we're seeing right here, which is the piriformis muscle. This one right here, and as you can see, the piriformis muscle goes from the sacrum. This bone actually goes deep inside, attaches to this bone, and then it reaches out to the greater trochanter. You see the sacrum here, and then the greater trochanter is right here. So that's what it is attaching to. And when you look at what does that do, if you contract that muscle, going like that, it pulls on this greater trochanter, it pulls it laterally or towards the back, and that brings the foot to the outside. So this muscle here is actually, and then a few down here as well, the collection, the group is responsible for turning the foot outward. It also is responsible for holding the spine and the pelvic joints, these SI joints, stable, because it's attached here and goes right into here like that. And it's very strong, it's very thick in here. And it connects, it like stabilizes when you walk and the spine moves a little bit, so it sort of contracts a little and balances stuff out. Clinically, it's very important because the muscle goes right where this big yellow thing comes out, and that's the sciatic nerve. And that nerve is the one that goes all the way down the thigh and into the leg and gives people sciatica. That's that bad, that's pain that radiates down below the knee. That's technically then called sciatica. You get people walk around and have bad back pain, they call it sciatica too, but it's not technically sciatica, it's just often a word, sounds worse than just back pain. That also happens. But if it is, traditionally, we're looking at a disc question, if you have a nerve compression that fires a nerve off. But we don't have to necessarily here, because very often the piriformis is strong enough in contracting that it squeezes that nerve. If we look at it here, this is a nice picture, goes to the front of the sacrum. You can sort of see it in here. And then to the tip here, if you contract it, pulls this back, and so that brings the foot out. And if you want to work it, you see the trigger points here. These X's are the trigger points. These are pain patterns that happen when these points are irritated. And so working, squeezing these points, or the doctor takes injects it with lidocaine, for example, relaxes these trigger points, and then these pain patterns can ease up a little bit, if that's the reason for that, of course. If it's something else, it will not help, but it's often the causation of pain patterns that go down the thigh. So then from there, we can go and move into, now we're working up here. So now we want to bring the leg out to the side, abduct the thigh. That's one motion. Then we're going to bring it back. Gravity will do some of that, let it hang, but not all of it. So that will be adduction. And then we want to also bring the hip back, the thigh back, that's extension. And then we also want to bring it forward, that's flexion. All right. And I actually, in that muscle chart thing I showed you, I'll get better at jumping back and forth. But in there, I'm working on also creating patterns that show the different motions on each joint and which muscles are doing it. I found a picture that visualizes it with arrows. It's really cool. But anyway, the first motion now of these four that I want to look at is the abduction, bringing the thigh to the outside. And we got a few muscles that do that. And those muscles are basically, for the most part, attached in the back here, in the glute area. So while we had this one muscle on top, that's the glute maximus. So we're going to take that off. And underneath that thing, we see this white reddish part, and that part is the gluteus medius. And that goes from the iliac crest, external iliac fossa, right underneath the crest, and anchors into the greater trochanter as well, like the piriformis did. So basically, one of the things you can understand these muscles are, they're all kind of attached back here on this rim area, and then they go to the greater trochanter, like the spokes in a wheel. And sort of depending on where they exactly attach is sort of a little bit of what the different motions they are doing. So the glutes are attached here, they go pretty steep down. When they contract, they're going to bring their thigh out. They're going to pull it up to the outside. And so that's two of those. And then we got the glute maximus and the tensor fasciae lata. So now this is interesting. So now I'm going to put this last butt thing on top. And this last big butt part, that's the gluteus maximus. But it's pretty flat, but it's very bright and wide and broad. And it goes to the outside laterally, and it attaches a little bit in here, and then it goes into this white band on the outside, this iliotibial tract. And you can see that right in here, indicated in here. And so you can see when that contracts, it sort of brings that, helps pull that thigh out to the outside. And then the last one is the one in here in the front. And that one is called the tensor fasciae lata. And that one is attached right here at the front part of the iliac crest, the ASIS, the anterior superiliac spine, and moves also into this fascia, this IT band. And the IT band's name is iliotibial tract. And it's really a flat tendon. If you feel it on, you can probably feel some of you can probably feel it on your thigh on the outside. If you lift it up to the side, it tenses up a little bit. It's called iliotibial tract because it moves from the ilium more or less down to the lower knee. That's the tibia more or less, even though it kind of goes into the fibula. But yeah. Well, the IT band itself is that tendon, and it just anchors brings the muscle belly from up here where it contracts and brings the force down all the way to the knee and pulls on the knee. It doesn't contract itself, but it's like a real strong cable that pulls on it. And so on here, we have the gluteus maximus goes down in here, and then in the front, the TFL goes down and feeds into the outside region. As you can see how the glute max is, a little bit up, and then the PSIs, and then the sacrum, and then it feeds a little bit, see, into this part of the bone here on the outside, but then it goes into the IT band that we can see here as it feeds in from the back. And then the TFL in the front, we see that here attached and goes down, the tensor fasciae lata. This band used to be called the fascia lata, and that means wide fascia, fascia lata. And so the muscle's name is still there, tensor, as in tensing the fascia lata, the wide fascia. Now we just call that thing iliotibial tract, to be more accurate. And then when we removed those over here, we see the medius and then the minimus. They both go into here. Well, let's go on the leg model and do those muscles real quick. So on here, so far what we've seen and done is the gluteus maximus, right here, take it off. And then here what we actually see, this is sort of, I kind of consider it the medius minimus complex, because they kept the medius on this part over here, so it's a little hard to see that. Then the piriformis is right here, and you always recognize the piriformis because you're going to have that yellow thing right underneath, that nerve, always. Then the TFL is right here in the front, the tensor fasciae lata. Yeah. So now we covered these muscles more or less on the butt. Now we're going to go to the inner thigh muscles, because we have this leg hanging out here. We've got to bring it back down. And again, gravity does some of that, but not all of that. Good, thank you. So when we look at these adductor muscles, they are as a group quite interesting because they're called the adductor group. So that's like logical. You know what the function is. You know the name is right there. Most of them are that name. We got, look at that. We got an adductor brevis, means short. An adductor longus means long. An adductor magnus means huge. And then we have two more. We have one that's called the gracilis and one that's called the pectineus. They're all right here, attached in the back of the thigh at the linea aspera. So this is the linea aspera, this ridge in the back here. You got a lot of muscle attached here. You're going to have these adductors attached here, and you're even going to have some of the quads attached back here on this ridge. It's so powerful. And then from there, these adductors generally go to the sit bone, that's the adductor magnus, or to the front, to the pubic tubercle area kind of place in this area. So they kind of fan out a little bit. Because besides bringing the thigh in, what they're really doing is when you do this kind of stuff, they stabilize when you go back and forth and zigzag. So look at some of the football players. Like, I don't know if McCaffrey's out now. When he plays zigzag a lot. Yeah, I worked on him. And that was the first muscle that I was working on. I'm like, oh, geez, he knew about it. And that's what I knew. He's a very smart guy. So on here, they're all starting in the back of the linea aspera. Again, most of all, but for our purposes, we're pretty good with that. And then they go to the sit bone. You see that yellow? That's the magnus. Or to the pubic front part. So to the back or to the front. And then we have one that's right on top. And that's on this side. That's the pectineus. And that one is attached also to the linea aspera. Or, between lesser trochanter, but, pretty much back there. That's the lesser trochanter. And then it goes to the pubic bone in the front. And it goes, we call it the pubic ramus. But it's really, here, ramus of the pubis. But we're really thinking of this whole area. This whole area is sort of the pubic ramus in this discussion. And we can then, in other anatomy books, when we go deeper and deeper, we can say, oh, it's the one on top, it's a little bit there in the pubicle, it's a little bit further down. But you don't have to, I have to worry about that if I have to work on those, especially if I have to work 18-year-old guys here in the front. I gotta exactly know what I'm doing. And then the last one is the gracilis, that also has a weird name. I kind of like that name though, so that's... And that one actually goes from all the way down the front of the tibia, a very interesting place, and reaches to the lower pubic area. This is a little bit wrong. It's not fully wrong, but it looks like it goes to the sit bone, but it goes a little bit further up. So if you actually color in a little here, then you got it covered. So that's really where the reality goes. I just worked it on a football kid who had it torn. And so that covers all those muscles that bring the leg back in. And on the model, it's really hard to see on the model. You see on the model, you see this muscle here. And that's the gracilis. All right, from there, so now we brought them out, we brought them back in, now we got to bring them back, bring the thigh back, and up to the front. The back we covered by the glute. I should have said that in the glute. The glute max brings this up. When we walk, the glute max brings the thigh up, and then the hammies bend the knee, and then the calf push down the toe, and then we can run. Maybe. Then the toe push up. That's why we did all these muscles, the hallucis and all that. Because, it's kind of cool. All right, so we did the extension. Now we're going to do the flexion. Let me find the flexion. We're going to go to the muscle right in here. And that's the only place where I can see that. I'm not going to see that on the leg. We're going to have a muscle right in here. It's known as the psoas muscle. The one that gives you a sore ass. Sorry. And beep. And then we got one on the side of the hip. And that's known as the iliacus muscle because it starts right at that iliac fossa. So one starts deep. This muscle goes to the front of the vertebra. I mean, you got to appreciate that. That's pretty steep. Look at this picture. This muscle goes to the front of the vertebra. When I went to chiropractic school, they told that one teacher, and no, it's not chiropractic school, I learned a lot, it's really good stuff. But he said, you can't work that muscle. I'm like, really? Janet Travell works that muscle. And she worked John F. Kennedy. So really, anyway, but you have to go deep. You have to go all the way to the spine. And so it attaches on that spine, and then it goes down, it reaches down underneath the inguinal ligament, and then it goes into this bump, and this bump is the lesser trochanter. So that's a small little bump. So that's a pretty big muscle that goes into this small little, so that's pulling pretty hard on that. And when it pulls, you can visualize that. It goes, woo, brings up that thigh. And then the cousin is one that attaches in here, the iliacus, in the iliac fossa, and goes to the same place. And you can think about how that would be helpful, right? You got one coming here, yanking on the spine, thinking up that leg, go like, oh, the pull comes from the spine. But then you also have one coming from here. You pull from both ends, you're much stronger. It's right in here, or it's right this white stuff in here. And I tell you, I found out, my poor patients, they lay face up, and the first place I go is that place, because it's mostly tight on people. I lift up the leg, and because we all sit. We're sitting like that. Even if we don't want to sit, we still sit a lot. And then that thing is shortened, because we just hold it. And then when we stand up, we have to lengthen it, because you know it from a long car ride. When you get out of the car, it's like, ooh. And that's because these are a little stiff. They shown in videos how these inner connections in the muscle, they stiffen up overnight. That's why the cat in the morning or the dog, they stretch like crazy. We should do the same thing. All right, so we did everything on the hip that we need to do. Now we can go to the knee and spend a brief moment down the knee. But the knee, in reality, that we want to work on is really about bending the knee and straightening it out. We don't have much of this going on up in here. We have a little locking. We have that popliteus muscle. So we're going to now have the hammies and the quads. So let's go through them. Look at that. We're going to first flex the knee. So we're going to bend it. Where would these muscles be? Here or here? In the front or the back? The back. You can actually do it and feel that tight, no? So those hamstring muscles we go for, they're attached to the sit bone. They're all attached to the sit bone. And then they go down to the knee. One goes two go to the inside, and one goes to the outside. Muscle here is the biceps femoris. Out here it goes from the sit bone to the outside where the fibula is. And then we have on the middle side, we have two muscles. They go both to the inside. And one is known as the semimembranosus, and one is known as the semitendinosus. So this is like, you're really gonna make me differentiate between those? Like, yep. You got muscles pulling equally from the knee up there, meaning they do this real nice. They bend that knee real nice. And they can, if you think about it, since they're attached up here, they also cover this joint a little bit. They can help a little in the hip extension potentially, if you get to that level where they have an advantage and they can pull on it and it brings it up more. So think, if I think patient stuff, if I think injury, that's how I think. And that gets me to the solution much better than if I look at a book and say like, oh, for back pain, let me look it up. Because the stuff is logical and we are creatures of nature and we ignore this intuitively, a lot of it. Anyway, but when it comes to the naming, we have, this is the leg, this now it becomes important. This is the big toe here, we got the glutes here, so this is the outside, and the pinky here. And so these muscles on this side where the pinky goes is where the fibula goes. So that muscle is the biceps femoris. And then you got another one on the inside, the medial side, and you got one, and we got two, you got two on there. One that's flat at the bottom. You can see down in here. You don't look up here, you look down in here. And the other one is sort of rounder, like tendony maybe, like stringier on top. And so the one that's on top is the semitendinosus, as in tendon being a little more stringy-like, in my mind at least. And the one below that, underneath that, is more broad, and it's known as semimembranosus, like more membrane-like. That's how I remember that. Anyway, and then we have the quads on the other side. So now we bended that knee. Now we got to straighten it out. We can't just go like that and then gravity will straighten it out. We got to be able to lift it up. For that, we got the quads. The quads are here in the front. They're four muscle quadriceps, means four heads. And they're all in the front, but two of them are attached in the back at the linea aspera. And then those two reach around the knee from both sides and grab the patella and go and anchor into the tibial tuberosity. And then in the front, we have two layers. We have one that's on the bottom, that's attached right in here, in this area, on the femoral shaft, anterior femoral shaft, and goes patella slash kneecap into the tibial tuberosity. And then we got one on top, and the one on top starts actually up in here, and then reaches down and goes towards the knee. The bottom one is the vastus intermedius, because it's in between the one on the outside, intermedius, and the top one is the rectus femoris. And so yeah, let me do the other names too, because when we look at here, we have these four. So the two ones that start in the back, they wrap around and you can see them bulging on each side. One is called the vastus medialis, the other one's called the vastus lateralis. The word vastus means big, gigantic, massive, vastive, festive, no. And then underneath, in the front, we have this rectus femoris, you can see that right here. And you can see sort of how it goes all the way up to here almost, like this muscle goes. So we got these four, and if we look at the model here, we're going to have the four. We're going to have one on top that goes up and down. That's the rectus femoris. I can take that off, maybe. And then underneath, you see this white stuff. That's the vastus intermedius. And then you got these on the side. That's the vastus medialis, and that's the vastus lateralis out here. And then we got the special kind, the special thing, and that's the sartorius muscle. And on a model, the sartorius muscle is this liver muscle that's laying right on top here, right here. It goes from the ASIS down into the medial chin. And when you think about when it contracts, it does this. It crosses the foot over to the opposite knee. All right, so from there then, when I go to the calf, or the leg. You know, technically this is the thigh and this is the leg. So in our world we saw this the leg, but if we start talking anatomy then we differentiate. So the leg, we have a few compartments here, but first of all we take away this big thing in the back. Look at how thick that is. That's your calf. And that's a small leg. That's a bicycle child's calf. But that's the calf muscle. That's known as the triceps surae, if I spell it out, because it has three heads altogether. It's got two on top, those are the gastrocnemius, and those are right here. Those two on the outside, you could take one of them off. And then underneath, you have a big muscle that's actually very thick, and that's known as the soleus muscle. And on here, you just turn it around, you got the soleus underneath here. You can actually see, if you see here from the side, you can see that layer on the bottom and then one on top. The bottom one is the soleus. You see that the gastric going up to here, and what's interesting is that the hammies come down to the outside, so they sort of interlock. That's kind of an interesting little detail. But then you take that off, and then this here is the soleus. So it covers the whole underside. But on top of it, you have the gastro. And so when you actually see these bicyclists, gastro pumping out, it's really, a lot of it is the soleus pushing from underneath. It's kind of like the brachialis and the biceps, you know, people who do the bicep thing. It's like a lot of it is that underneath pushing. It's kind of a similar makeup. Good question. And then from there, we're going to go to these compartments. And we're going to have three compartments down here. And they call them compartments because they got membranes separating them. And so sometimes people, like basketball players, jump ball, they get compartment syndrome, where the muscle pushes out against the sleeves of the muscles, and that becomes a problem. And but anyway, we're not here to talk about those problems. But we have a compartment in the front, right here. We have a compartment in the back, a deep compartment, where overlying is the triceps surae. And then we got also a compartment here on the outside, right here. So when we look at the front and back compartment, we got the big one is the tibialis anterior. That's right next to the shin. And that muscle goes right to the tarsals in here, more or less. You know, you have to read that exactly. It just goes not to the digits. It goes to the ankle part of the foot. So when that contracts, it brings it up. The ankle part helps with that, okay? It also helps with flat arch potentially a little bit. So it could be a little, you know, that could be an interplay with that muscle. And then we have, in the back, we're going to have an equivalent posterior one, tibialis posterior. But then we have two more that go to the toes. And we got one that goes to, they're both called extensors, the ones that lay on the front here, the anterior compartment. One is the extensor digitorum, and one is the extensor hallucis. Now, digits are things, these are digits, right? So the digitorum one is clear, goes to the toes. Hallux means big toe. Pollex means thumb. So we have some main muscle called pollicis or so. Those are in the thumb. And then hallux means toe. So if you see the word hallux, you're thinking big toe. And so in the front, then we have these other two. So we have the tibialis anterior next to it. In the middle here, we got that purple one. That's the tibialis, the flex extensor hallucis longus. And what you do with these muscles, when you see them like on a model, you follow them to the tendon. Where's the tendon go? And then it gives you the name away. And then the one on the outside here, right by the fibula, on the front side of the fibula is the extensor digitorum longus. And you see how that goes to the digits, the toes. So here, look at that. We got one right next to the shin, tibialis anterior. And then we go to the tendons. Then we got one that goes to tendons, go to the toesies. That will be the extensor digitorum longus. And then as in that picture over there, the other one where you can see the tendon goes to the big toe, you follow it up and you see that little skinny thing in there, like the inside here, that's then the extensor hallucis longus for the big toe. Big toe. I know it's a lot of information on the test, pretty much, but I want you to understand it. Because then when you go to another class, you don't have to relearn it, you know it now. Once you understand it, you know it. That's the power of that. At least I think. And then we got the posterior compartment, and the posterior compartment is very similar to the anterior compartment, the deep one. That's like remove the gastroc thing. We have a posterior tibialis or tibialis posterior, and now instead of extension, we have flexors because now we bend the toes down. That's flexion. So those are flexors. We have one for the digits, one for the hallucis. And of course, we always know there's more, right? There's tons more, thank God. Otherwise, we couldn't walk. But this is giving us a real good foundation. And not just in knowing that, but also in the naming, so you understand. If you see another one, you can go like, maybe that's there. Then you look it up. So here again, in the middle, is the posterior tibialis, tibialis posterior. So you see that here. And again, that one will go to the ankle bones. And it sort of pushes that ankle down as an ankle. And then the other ones, these are now interesting. This is probably the hardest one in the foot. Because we got one on the inside. This is medial. See here the small toe. So this is medial. And this is known as the flexor digitorum longus. But on the medial side, you got the toe, the big toe, not the little toes. And so this is like the wrong side when you look at this picture. But what actually happens is this dark muscle goes underneath and then crosses over from the big toe side to the little toe side. So if you see this here, you go like, well, it's on the side of the big toe. It's not. That's wrong. It's not. Just remember that. And then the last one we go left here is on the other side. On the little toe side, we go on that's known as a hallucis, flexor hallucis longus. And that also is going to have to go from the outside and cross over to the medial side to attach to the hallux, the big toe. A little bit, that's a lot of data, okay? Yes?
What's dorsiflexion?
Oh, that is side extension. Yeah, in the foot they use the term dorsiflexion for bringing the toes up and plantar flexion for bringing them down. And I always remember plant are planted in the ground. No, they're not in the air. All right, that's how I remember it. But then when it comes to the muscle, they keep using the word flexion and extension. I don't know. They can't make up their mind. And we just have to go with it. The government of anatomy. And then the last compartment is not. The fibularis muscles are attached on the outside, back outside of the fibula. Let me show you on the bone. So on the bone here, we have the fibula out here. And those fibularis muscles, they used to be called peroneus, P-E-R-N-E-U-S. And then they decided it's the bone's called the fibula. Why don't we call it fibularis and make it a little easier? And so now, but if you see that still in the book, you catch it. So they're all attached right in here. And so they're all on the outside, on the back portion of the fibula. And then they go, and one of them reaches underneath the foot all the way to here. So it grabs the foot like that. And it holds it this way. And that's, when you twist your ankle, you twist it this way. So this muscle helps prevent the ankle to be twisted all the time if you have floppy ligaments. The other two, the lower twos, for us on the test is just one fibularis, but there's multiple layers. They go to this area, so they help stabilize the ankle this way. So that way you have a multiply. You have one going, a couple coming here, and then one going around and pulling from underneath. These are very, very important muscles because most of us twist the ankle a little bit once in a while, or have in the past. And so, generally speaking, and we're meant to be walking on grass barefoot, and that's not really happening. And so we don't have that same dexterity. No, I mean, that's interesting. Thinking about it. I was in Borneo walking in the rivers, creeks, when I was like 20. And first I was like, with shoes. Fall down, fall down, fall down. I'm like, the people we went to, they were barefoot. I'm like, I'm not going to go barefoot in that water with all that whatever's in there. I don't know. And of course, after 5 minutes, it's like, oh, crew the shoes. They go on the back. And it's like you totally learn how to walk different. And within no time, your feet are so much more agile than anything that you imagined they would be when we always wear shoes. And so, this twisting ankle thing is partly this modern lifestyle thing. And on the model, they're right out here. So if you see the pinky, they're going right out. You can actually see the tendon right here, the one I talk about, the lower one. And then the other one goes underneath. I don't think you can see that. That's underneath. The foot from the sole to the bone is 4 layers of muscle. It's really cool stuff. All right, so that's what we have with this. Any questions to that? Or is that pretty much for sleep? Good, then have a snack.